Hello everyone. Welcome back to my channel Medico Survivor. If you are new to this channel, please subscribe my channel for more informative videos. Today we will discuss pneumonia, which affects about 450 million people globally and results in 4 million deaths. Let's start with an introduction. What is pneumonia? It is inflammation and consolidation of lung parenchyma due to infectious agents. Now, what is consolidation? The presence of fluid that may be exudate, transudate, or blood, cells, tissues or other material in alveolar air spaces. Infectious agents that may cause pneumonia are bacteria like Streptococcus pneumonia, Mycoplasma pneumonia. Fungi may include Aspergillus and virus like influenza coronavirus. Let's have an overview on pathophysiology of pneumonia. Due to various etiological factors, when microbes enter in respiratory tract, it releases toxins, as a result of which there is activation of immune response, like mucus production or cough. Further, microbes penetrate towards the lower respiratory tract and trap in terminal bronchioles and alveoli. In affected area of alveoli, blood vessels dilate and blood flow increases. Due to the presence of microbes, consolidation of leukocytes and fibrin take place, which causes congestion, means alveoli filled with fluid or pus, which results in consolidation of lungs and ultimately cause pneumonia. Types of pneumonia. There are various types of pneumonia. On the basis of etiology, it may be infective and non-infective pneumonia. On the basis of morphology, it is of three types: lobar, broncho and interstitial pneumonia. Clinical types include primary or secondary, typical or atypical, community-acquired and hospital-acquired pneumonia. And on the basis of duration, it is acute pneumonia, that is of short duration, and other is chronic pneumonia, that is of long duration. Now, on the basis of site of infection, the first type, lobar pneumonia, involves infection of single lobe or section of a lung. Second type, interstitial pneumonia, is due to infection between the areas of alveoli. And bronchopneumonia occurs when lungs are affected in patches around the bronchi. Next is the aspiration pneumonia, which is an infection of lungs by inhaling saliva, food, liquid, vomit and small foreign objects. Other types include hospital-acquired pneumonia, which occurs 48 hours or more after patient's hospital admission and was not incubating at the time of admission. It is more serious than other types because hospital-admitted patient already has low immunity and pneumonia-causing microbes may be antibiotic resistant. Ventilator-associated pneumonia, VAP. It's a type of hospital-acquired pneumonia that arises more than 48 to 72 hours after endotracheal intubation. Pneumonia-causing microbes may be present on instruments of ventilator. Community-acquired pneumonia is an acute infection of parenchyma in a patient who has acquired the infection in the community. It occurs mostly in winters because influenza virus is most common in winter. Symptoms may include headache, sputum, cough, loss of appetite, chest pain, runny nose, pallor of skin, blood and sputum. Here are some risk factors of pneumonia, and easy way to memorize risk factors is to remember the word inspiration, which includes immunosuppression, neoplasia, secretion retention, pulmonary edema, impaired alveolar macrophages. RTI means respiratory tract infections, antibiotics and cytotoxics, tracheal instrumentations, intravenous drug use, Others include immobility, neurological impairment of cough reflex. Investigation. How pneumonia is detected. 1. Physical examination. 2. Blood test. 3. Chest X-ray. 4. Urine test. In a urine sample of a patient, there is streptococcal pneumonia antigen, which determines pneumonia. 5. Sputum culture test. This test identifies bacteria or fungi causing pneumonia. 6. PCR appears to be a sensitive diagnostic test for identifying patients with pneumococcal pneumonia. Hospitalization criteria for pneumonia. CURB-65 is a tool used for the assessment of severity in community-acquired pneumonia. CURB-65 equals confusion. Uremia. Respiratory rate. Blood pressure. 65 years of age and older. Each risk factor scores 1 point. For 0 to 1 point, consider outpatient treatment. For 2 points, consider a short stay in hospital. Score 3 requires ICU admission. Outpatient treatment for pneumonia. For patients without comorbidities. Amoxicillin 500 mg 3 times daily. If a patient is allergic to penicillin, then consider macrolide like clarithromycin or azithromycin or doxycycline. For patients with comorbidities, combination therapy includes amoxicillin/clavulanate or cephalosporins plus a macrolide, and monotherapy includes respiratory fluoroquinolone like levofloxacin, moxifloxacin. Inpatient or hospitalized patient treatment. If patient is non-severe, then consider combination therapy, which include beta-lactam, ampicillin, ceftriaxone plus macrolide. For monotherapy, consider respiratory fluoroquinolone. For severe patients, consider beta-lactam plus azithromycin or a fluoroquinolone. Complications. Here is the mnemonic. Slap her. But don't do this in real. Septicemia means blood poisoning by bacteria. Lung abscess. Acute respiratory distress syndrome. It's a life-threatening lung injury that allows fluids to leak into lungs. Parapneumonia effusions means buildup of fluid in pleural cavity. Hypotension. Empyema means pus in pleural space. Renal or respiratory failure. To prevent pneumonia, take following precautionary measures. 1. Keep yourself vaccinated. 2. Avoid junk food. Eat healthy. 3. Do exercise regularly to stay physically fit. 4. Stop smoking. 5. Avoid gatherings and maintain social distance. Thank you for watching. Please do like, subscribe and share.